Thank you, Madam Speaker. Last Wednesday, I informed the Prime Minister that 35 doctors and addiction experts had recently wrote to the Minister of Mental Health and Addictions, recommending significant reform or outright abolishment of the safe supply drug addiction strategy. Madam Speaker, these were not cruel and heartless recommendations, far from it. The letter was a response to those who champion Band-Aid safe supply strategies. These misguided champions seem totally oblivious to a simple scientific fact. Harm reduction without treatment does not break the cycle of addiction. Madam Speaker, in Toronto and across rural and urban Canada, the safe supply strategy isn't working. It adds to, not reduces, addict deaths. Madam Speaker, I asked the Prime Minister to listen to what doctors and experts were saying. These were not some ideologically twisted individuals. They are caring healthcare professionals who specialize in addictions and substance use. Madam Speaker, I further asked the Prime Minister to provide appropriate funding to municipalities hosting injection sites so that they can keep their people safe. Instead of taking my suggestion seriously, the Prime Minister repeated the alleged mantra that the government will, quote, will remain grounded in science, not ideology, end quote. Madam Speaker, the government is not following the science. Additionally, why follow blindly questionable science that supports a strategy that basically amounts to government-assisted suicide? Madam Speaker, where's the ideology in questioning a dubious safe supply strategy? Are addicts' lives changed for the better by a strategy that, in the final analysis, leaves far too many dead? So, Madam Speaker, what do the experts say? Well, in the forthcoming Macdonald-Laurier Institute report by Adam Zivo, Dr. Meldon Kahan, who recently retired as medical director of the substance use service at Toronto's Women's College Hospital, said most patients, quote, who are actively using fentanyl will be far more attracted to the tablets than to opioid agonist therapy. Unproven fentanyl tablet programs could thus well end up diverting people away from life-saving evidence-based treatment, end quote. Dr. Martin Judson, an addiction physician who pioneered the use of methadone in Ontario, said offering powerful, short-acting opioids is, quote, the last thing which should ever be offered because that encourages the destabilization of the nervous system and physical tolerance, contributing to individuals seeking ever more supplies of opioids, end quote. Madam Speaker, in the letter to the minister, which I referenced to my question to the Prime Minister, the authors are all expert clinicians that have extensive experience in addiction medicine. They sent that letter because they're deeply concerned about the continuing rise in opioid-related hospitalizations and deaths and Health Canada's inadequate response to this crisis. Madam Speaker, they pointed out to Health Canada's current focus on safe supply ignores opportunities to fund and support the implementation of accessible, quality opioid agonist treatment to help people across Canada break the cycle of addiction. Madam Speaker, OAT is considered to be the most effective public health strategy for reducing opioid overdose deaths and opioid-related hospitalizations. Therefore, Madam Speaker, in addition to asking again, one, will the Liberal government listen to the experts on reforming or abolishing safe supply? Two, will the Liberal government prioritize the safety of communities who host injection sites and provide them with the resources needed to keep them safe? I also call for Health Canada to increase funding for projects that increase access to OAT and improve treatment and retention rates of OAT programs. Thank you, Madam Speaker.
The Honourable Parliamentary Secretary to the Government House Leader.
Yes, thank you, Madam Speaker. Substance use in the shaped by complex factors, many of which are beyond an individual's control. These factors include experiences in trauma, physical and mental health, income and access to stable housing, and the ongoing effects of colonization and the residential school system on First Nations, Inuit and Métis communities. That's why we need a comprehensive, integrated, evidence-based response that it's grounded in the four internationally recognized pillar of substance abuse and use policy: prevention, harm reduction, treatment, and enforcement. Not one or the other. Not one against the other. All of them, Madam Speaker. The toxic drug supply is killing people. People don't know what they are consuming. People fear the criminalization, which led them to use alone and die alone. Stigmatizing Language like the member used, talking about closing essential health services, will just increase the harms. Creating false narratives is not useful to anyone. Through the investments we've made, we will continue to improve access to evidence-based treatment and life-saving harm reduction services and supports for people who use drugs. Since 2017, we have funded close to 400 projects across Canada at the community level through Health Canada's Substance Use and Addictions Program to support and build the evidence with respect to innovative approaches to prevention, treatment, harm reduction, and recovery. These investments are part of our comprehensive strategy to address problematic substance which we have committed to more than $1 billion since we formed government. Madam Speaker, our approach to saving lives and protecting the health and safety of Canadians is rooted in evidence. This crisis is evolving every day, and our response must follow the same pace. We need to look at all innovative solutions to put an end to the strategy. We can't be working in silos or through an approach that isn't integrated. Madam Speaker, offering treatment alone is not enough. Providing a broad array of care options and wraparound supports allows people to access the right services at the right time to improve their overall health and well-being. Supervised consumption sites are essential to keeping people who use drugs alive, and by providing them access to a range of support services in a safe and supervised environment, staffed by trained professionals and peers. They have seen over 4.3 million visits and responded to 50,000 overdoses. Importantly, SCS are responsible for over 256,000 referrals to health and social services. Above and beyond the lives saved thanks to these sites, countless illness and infections have been avoided, prevented, or attended to. All levels of government must work together to ensure access to these life-saving services in a manner which also respects community safety. The Supreme Court of Canada, experts, service providers, and people with lived experience agree that supervised consumption sites save lives and often are the first step along the path to a healthier life. We remain committed to a collaborative, comprehensive, compassionate, and evidence-based approach to addressing the overdose crisis. Thank you, Madam Speaker.
Member for Spadina, Fort York.
Madam Speaker, the parliamentary secretary says they're following the science. They're following the experts, but I have cited experts who specialize in addiction and substance use medicine, and what they are telling this government is what's happening is not working. You can accuse us of stigmatization or at least false narratives, but the reality is if this government will leave their ivory tower and walk the streets of the communities that host these sites, they will tell you that harm reduction without treatment is not working. Look at the trend of deaths. It's unfortunately only going up. Why would we continue to do what isn't working? And now I've cited a number of times injection site in my riding. If the parliamentary secretary doesn't believe that, fine. There is one in Toronto Danforth, and there's a constituent I spoke to from the member of Toronto Danforth, Brooke, who said the injection site is, quote, not harm reduction, but harm facilitation, end quote. This government needs to listen to the experts and either abolish or reform safe supply.
Parliamentary Secretary.
Well, Madam Speaker, I disagree with the member's approach. Because at the end of the day, he doesn't recognize the reality of the consultation and the work that's put into ensuring that the right decisions are in fact being made. It's not a silo. We work with, Madam Speaker, different levels of government, first responders, victims, Madam Speaker, and I will call them victims. We work with community members. It's not one individual that makes the decision. It's not one individual that says, oh, I think it's a bad idea, and that person happens to have a DR in front of the name. That's not what dictates it. There's a much broader consultation that needs to take place, and we have seen the evidence has been very, very clear in terms of with the success of programs such as this, Madam Speaker, and I would hope even the Conservative Party of Canada would recognize, Madam Speaker, that we are saving lives